Hello and welcome once again to our COVID dialogue, where today we are focusing on two major concerns: Kerala's rising numbers and is India heading for a third wave? Joining me now, the country's top virologist, Dr Gagandeep Kang, joins me from Vellore. Appreciate your joining us, ma'am. I want to start first with how you view the situation in Kerala. Is it alarming to see one state registering such high numbers even as COVID numbers come down in the rest of the country? Is there something about the Kerala model that we now, so-called Kerala model, that we need to worry about at the moment?
I think it is a matter of concern when you see cases rise in one location in a country. But we also have to remember that we're in the context of a pandemic that is evolving. So if we look at the numbers, we are in a situation where the serology data showed us that the whole country had a seropositivity rate that indicated that 2 out of 3 Indians had already been exposed to the coronavirus, whereas in Kerala, that was only 44%. And in each case, some of that was contributed by vaccination, and the proportion contributed by vaccination was greater in Kerala, which meant that Kerala had among the largest proportion of people that were susceptible to infection. We also have a situation where Kerala as a state was among the highest rates of testing per million population in the country until the beginning of August. Then they dropped their testing rates, and they're currently at 19 tests as a test positivity rate, which clearly indicates that they are not testing and they're not detecting all the cases that they have. So that is a concern. We saw a smallish spike in Kerala after Eid, and we are seeing this larger spike now after Onam. What we had warned about was that there should be an avoidance of crowding, a push for vaccination. The push for vaccination happened, but the avoidance of crowding, I am told, did not happen in the same way that it should have leading up to Onam. So the consequences of that are there for everyone to see. Now, what's going to happen in the future? Well, the central government is providing Kerala with vaccines, and they are vaccinating as fast as they can. They have the highest, among the highest coverage rates in the country. Certainly for mid-sized states, they are leading. We have currently 30,000 plus cases reported over the last couple of days with high test positivity rates. But what I would like to point out is that while all of India is reporting currently a test positivity rate of 3% or under, it's very important to look at what Kerala's test positivity rate has looked like in the past, because that explains how they test. And their average test positivity rate is at 12%, indicating that Kerala is largely testing people that it expects to find positive. So I think there are a number of factors there. The increase in cases is a concern. The hospital systems are not overwhelmed at the moment. Kerala has previously handled a peak with 40,000 plus cases being reported every day during the second wave. But we don't want to go there again, which means that we need to be increasing testing, increasing public health measures in Kerala, even as vaccination is increased.
But I want to understand, because, the fear, Dr. Kang, is that Kerala could lead to a third wave across the country. We are seeing breakthrough infections in parts of Kerala, about 5 districts where 5% and more infections are from people who are double vaccinated. Is that a concern, that what is happening in Kerala, because of these so-called breakthrough infections, could in a way precipitate and be a prelude to a potential third wave?
Okay, so let's look at the pandemic and what we said would happen. We said once the bulk of the country is vaccinated or infected, we will wind up with situations where there will be pockets of individuals that will not be infected or vaccinated, and those will be the areas that will be more susceptible to infection and are likely to see flare-ups of infection. Now, that effectively is what we are seeing in Kerala. If we look at third waves, when will we get a third wave? We will get a third wave if there is a new variant. And we are told that from the genomic sequencing data in Kerala, what we are seeing is still 90% of the Delta variant. So there doesn't seem yet to be a new variant. The second reason why we might see a third wave is if we had pockets of individuals that were distributed not evenly through the population, but had networks that would enable them to spread to other pockets in states outside of Kerala. Now, if that kind of situation exists where there are susceptible pockets outside Kerala that Kerala can then transmit to, we might see more flare-ups in other areas and increase overall that could lead to onward cascading transmission across the country. But we don't have pockets with that level of either connection or susceptibility currently outside Kerala. I could be wrong about this, but so far we have not really seen that there have been clusters of cases that have arisen outside of Kerala that came from Kerala. Now, obviously, more detailed data would be useful, but at the moment we don't have that. So I'm not particularly concerned that this is a third wave that is going to roll across the entire country, but better data would obviously help. Where Kerala itself is concerned, what we want is for Kerala to be able to suppress transmission right now. And the best way to do that is by increasing their testing and making sure that where isolation, quarantine, and treatment of individuals is required, that is implemented. And that needs to go in parallel with continuing to avoid crowding wherever possible, placing restrictions on how many people can be in any location at any time, and of course, ensuring that masks and high quality masks are worn.
Ma'am, on Kerala itself, the the whole picture from what you're saying, does it suggest that the Kerala model has failed? Because a year ago, everyone was praising the Kerala model. Its health minister, Shelja, was being hailed by people. Its case fatality ratio, interestingly, was 0.4%. It's now 0.63%, but still well below the national average of about 1.4%. How are we to see this? Is Kerala a success story in fighting COVID? Or do you believe the jury is out and something has gone drastically wrong between 2020 and 2021?
Well, I haven't seen any data that tells me, other than the fact that Kerala allowed for people to congregate at the time of Eid and at the time of Onam. I have not seen anything that Kerala has done that is wrong. Now, I understand that there was a national group that went to Kerala a few weeks ago and came back and said that Kerala's tracking of contacts and testing of contacts is relatively low. I think they said 1.2 to 1.5 per case. And that is low, but there are two things to consider here. One is How good is it in other states as a comparison? Because the government recommended that there be 12 to 15 contacts traced for every case, and some places went up to the multiple tens for tracing in the initial stages of the pandemic. Is that still something that is relevant to push to that level when you have tens of thousands of cases? That's something that modelers say loses value after a while. So I think the government should look at whether its recommendations should change. And if they think that in the Indian context, given our social mixing patterns, we should not be changing that recommendation, then yes, every other state and Kerala should do better on doing contact tracing and testing. Other than that, and the crowding, which I mentioned earlier, I'm not sure what Kerala has done wrong. In fact, if you look at any other quality parameter on what should be done in order to ensure that there is control of the pandemic, I'd like to know what else Kerala should have been doing. Their hospital system is not overwhelmed. Their testing rates, even though they have declined for Kerala at the beginning of August, they've recently picked up over the last couple of days and should go higher. But they're actually testing at much higher rates than many other states in the country. So I'm not sure what else we are expecting from Kerala in order to be able to suppress this flare of the virus.
Let me then, Dr. Kang, come to another critical issue which is being raised. The belief that we are now entering, and I quote here the WHO Chief Scientist, Dr. Soumya Swaminathan, some stage of endemicity, where there is a low level of transmission, moderate transmission, where the virus is not going to see the kind of exponential growth and peaks that we saw a few months ago. Dr. Swaminathan said this a few days ago. Do you agree with that? Do you agree in that sense the worst is over and we may be entering from epidemic to an endemic stage and therefore will not face a really virulent third wave, ma'am?
Well, I think this is not just about India. I think it is about the whole world. We are all in a very similar situation where we've been through very large peaks of infection that were driven by the original virus as well as by variants. Now, we've been very lucky with the variants, that the variants were viruses that became much more transmissible, but the variants that offered the greatest immune escape were ones that were not quite as fit as the ones that succeeded in taking over. So, for example, if we look at the beta and gamma variants, they seem to have greater immune escape from the vaccines than the alpha and delta variants. But alpha and delta were able to spread much faster in population. So in that sense, we've been lucky. Now, if we wind up with a variant that is both transmissible and capable of a much greater level of immune escape, then we continue to be vulnerable to that variant. And then the chances of beginning to see rises is possible. But even if that happens, given that these are sarbecoviruses, they are very closely related to each other, I think it is unlikely that we will see a general peak of any new variant. What we may see is that in people who have senescent immune systems that are suppressed or aging, then in those people, we may see an increased level of susceptibility. There is a really rather nice study that came out of Singapore a couple of weeks ago, I think, which showed that among people who had been infected with SARS in 2003, who then got vaccinated, if you studied antibodies made by those individuals, those antibodies had the ability to recognize and neutralize a range of coronaviruses. And that to me is very reassuring. It's showing us that if our immune systems are functional, we have the ability to handle the SARS coronaviruses and related sarbecoviruses quite well.
But it seems, Dr. Kang, that we are getting two very different pictures. We have got the National Institute of Disaster Management, a committee of experts constituted by the Government of India, which has given a warning of a third wave, suggests that if current vaccination rates are not increased, India will witness 6 lakh cases per day from October in the next wave. And we've got Dr. Swaminathan and you also now suggesting we are entering some kind of endemicity, a view you're endorsing, and thereby building a certain level of immunity. How am I to interpret two very contrasting reports of whether this country will have a third wave or not? What's likely to happen?
If I recall correctly, I was also asked to participate in one of the panels that the NIDM had organized, and the panel that I was on was looking at preparedness for children and what needed to be done in case there was a requirement for more facilities for children. And certainly in the panel that I was on, our discussion was around the fact that children are less affected by any of the variants that we have seen so far. It's not zero, but children are unlikely to have severe disease if infected. But at some stage, we will think about vaccinating children, and that preparedness for hospitals to be able to handle children, increasing expertise, increasing capacity is always a good thing, because you want to be able to provide specialized care for children, not just for SARS-CoV-2, but for other conditions as well. So that was the discussion at the NIDM. I don't recall who and when this calculation of the large number of cases in the third wave was made. I think that it's extremely unlikely that in the absence of a new variant, we would see anything like those numbers in the future. I have great faith in our immune system. I have great faith in our ability to be able to handle viruses in general. And quite frankly, with SARS-CoV-2, it could have been a lot worse in the first and second waves than it wound up being. So I do agree that this is a virus that, at least for the next few years, we are going to have to learn to live with, learn to handle. And it's time for us to begin to think about shaping what our future really looks like. What is it that we need to have in place that will allow us to continue to function as a society while continuing to provide prevention to all those who need it and healthcare to all those who need it, without focusing all of our efforts only on SARS-CoV-2. There is a lot of damage that is being done to people because services for other acute and chronic conditions have begun to suffer, not begun to suffer, have been suffering for the last 18 months. We have to build that back, and we have to build back better to include preparedness for future outbreaks, because SARS-CoV-2 is not going to be the last one. But this one, right now, we need to know how to live with it.
How much of the confidence that there will not be this virulent third wave, ma'am, is dependent on India's vaccination drive? By year end, at present rate, India will have double vaccinated about 32% of its adult population. We are hoping the numbers will increase. Vaccinations are increasing. As of now, about 60 crore adult populations have had a single dose. That's more than half. Is that the key now? Or are you saying, irrespective of vaccination rates, we are now in a better place today to combat corona than we were 3 or 4 months ago during the second wave?
Well, we suffered 3 or 4 months ago, and the consequences of that is we are in a somewhat better place. But there's no avoiding the fact that we need to vaccinate everybody. and we need to ultimately give everybody at least 2 doses of vaccine while preparing to think about who might potentially need a third dose. It seems very clear that people who are immunosuppressed, who, for a variety of reasons, from prolonged steroid therapy to chemotherapy to transplants, they are likely to need additional doses of vaccine. So what we need to be doing is preparing the path for them, but making sure that while we do that, we don't let up at all on our efforts to immunize every adult in this country, and then think about what we want to do about immunizing children. For me, I think it's pretty clear that for any children with comorbidities, they should be prioritized for vaccination.
Dr. Kang, what about the reopening of schools and businesses that is happening? Do you support it? Do you believe now that we have reached that stage where we must open up completely, more aggressively?
I think schools should be the first to open. And for schools to open, a certain level of preparedness is required. All teachers and staff should be fully immunized. And we should be looking at rules for masking and ventilation within schools. If we can, and not all schools have that luxury, making sure that we could reduce class sizes or hold classes in open areas or think about shift systems. I think there are adaptations necessary, but I think it's essential that schools open. Our children have been without schools for too long now. We should also, as I said, immunize children with comorbidities, make sure that they can go back to school. The opening up of businesses, the opening up of other spaces also needs to be calibrated. I think we need to be thinking about, this is not a done deal yet. We can't suddenly tomorrow open everything up and throw all caution to the winds. We have not managed to vaccinate enough. I think it's fantastic that we've reached 600 million people vaccinated or 600 million doses given out, but we do have a long way to go. And until we get to 2 billion doses distributed, we still need to open up with caution.
Dr. Gagandeep Kang, for joining me once again on the Corona Dialogues. Thanks very much. Thanks very much for watching. Bye for now.